You walk into a room and forget why you're there. You read the same paragraph 3 times and still have no idea what it says. You're searching for a word that's right on the tip of your tongue, but you just can't find it. That mental cloudiness, that feeling like you're thinking through mud, that's brain fog. And if it's not going away no matter what you try, there's a reason. Actually, there are several reasons, and most doctors miss them completely. Today, we're breaking down the real causes of persistent brain fog, and more importantly, the specific interventions that actually work. Because once you address the root cause, the fog lifts. Let's get into it. So first, let's be clear about what brain fog actually is, because it's not a diagnosis. It's a symptom. Brain fog is that subjective feeling of mental cloudiness, difficulty concentrating, poor memory, slow thinking, and lack of mental clarity. It's like your brain is running at 60% capacity when you need it at 100%. And here's what's frustrating. When you tell your doctor about brain fog, they often dismiss it. They might say it's stress, or aging, or just being busy. They might prescribe an antidepressant or tell you to get more sleep. And while those things might help, they're usually not addressing the actual underlying problem. Brain fog isn't just in your head in the psychological sense. It's a real physiological symptom indicating that something is off. Your brain isn't getting what it needs or something is interfering with its function. The good news? Once you identify the root cause, brain fog is often very fixable, but you have to look in the right places. Most people are treating symptoms instead of causes, which is why the fog never fully lifts. So let's walk through the most common root causes of persistent brain fog, and I'll tell you exactly what to test for and what actually works to fix each one. The first and probably most common cause of brain fog is chronic inflammation, specifically neuroinflammation, inflammation in your brain. When your body is dealing with chronic inflammation anywhere, your gut, your joints, your blood vessels, inflammatory cytokines circulate throughout your body and cross the blood-brain barrier. These inflammatory molecules directly interfere with neurotransmitter production and neuronal communication. Think of it like this. Inflammation is static on the line. Your neurons are trying to communicate, but the signal is being disrupted. The result is slow thinking, poor concentration, and mental cloudiness. Common sources of chronic inflammation include poor diet, especially diets high in refined carbs and seed oils, gut problems like leaky gut or dysbiosis, chronic infections, food sensitivities, high stress, poor sleep, and lack of exercise. So, what actually helps? You need to identify and address the inflammation source. Get tested for inflammatory markers like high sensitivity C-reactive protein and homocysteine. If they're elevated, you've got inflammation. Dietary changes are huge. Cut out refined seed oils, reduce sugar and processed foods, increase omega-3 intake from fatty fish or supplements, eat more anti-inflammatory foods like berries, leafy greens, and turmeric. Consider an elimination diet to identify food sensitivities. Gluten and dairy are common culprits. Fix your gut health, which we'll talk more about. Prioritize sleep, which is when your brain clears inflammatory debris. And move your body. Exercise is one of the most powerful anti-inflammatory interventions available. Many people see dramatic improvement in brain fog within weeks of reducing systemic inflammation. The second major cause of brain fog is blood sugar dysregulation, and this affects way more people than realize it. Your brain runs primarily on glucose. It's an energy hog, using about 20% of your total glucose despite being only 2% of your body weight. When your blood sugar is unstable, spiking high, then crashing low, your brain doesn't get a steady fuel supply. The result is brain fog, especially in the afternoon after meals. If your brain fog gets worse after eating, especially after high-carb meals, blood sugar issues are likely involved. You might also experience energy crashes, irritability when hungry, cravings for sugar or carbs, and difficulty concentrating between meals. The underlying problem is often insulin resistance. Your cells aren't responding well to insulin, so glucose isn't efficiently entering cells, including brain cells. Your brain is literally energy-starved despite plenty of glucose in your bloodstream. What actually helps? Get your fasting glucose and fasting insulin tested. Also ask for hemoglobin A1C, which shows your average blood sugar over 3 months. If your fasting glucose is over 95, fasting insulin is over 5, or A1C is over 5.5, you've got blood sugar regulation issues. The fix is straightforward but requires consistency. Balance your meals with adequate protein, healthy fats, and fiber. Don't eat naked carbs. Always pair carbs with protein and fat to blunt the glucose spike. Consider reducing overall carb intake, especially refined carbs. Exercise is crucial. It improves insulin sensitivity dramatically. Even walking after meals helps. Strength training is particularly effective at improving glucose disposal. Supplements that can help include magnesium, chromium, alpha lipoic acid, and berberine. But diet and exercise are the foundation. Many people report their brain fog lifts within days of stabilizing blood sugar. The third cause is thyroid dysfunction, and this is missed all the time because doctors only test TSH. Your thyroid hormones regulate your metabolic rate, including your brain's metabolism. When thyroid function is low, even subclinically low, everything slows down, including your thinking. Hypothyroidism causes brain fog, along with fatigue, weight gain, cold intolerance, dry skin, hair loss, and constipation. But here's the problem. Standard thyroid testing often misses subclinical hypothyroidism or problems with thyroid hormone conversion. Doctors typically only test TSH, thyroid-stimulating hormone. If it's in the normal range, they tell you your thyroid is fine. But TSH doesn't tell the whole story. You need to test free T3, free T4, and thyroid antibodies to get the full picture. Some people have normal TSH and T4, but low T3. T3 is the active thyroid hormone that actually does the work. If you're not converting T4 to T3 efficiently, which can happen with nutrient deficiencies, inflammation, or stress, you'll have hypothyroid symptoms despite normal labs. Others have Hashimoto's thyroiditis, an autoimmune attack on the thyroid, which causes fluctuating thyroid function and brain fog. This is diagnosed by testing for TPO and thyroglobulin antibodies. What helps? Get comprehensive thyroid testing. TSH, free T3, free T4, reverse T3, TPO antibodies, and thyroglobulin antibodies. If results show dysfunction, work with a doctor who understands thyroid optimization, not just normal lab ranges. Address nutrient deficiencies that affect thyroid function: iodine, selenium, zinc, iron, and vitamin D. Reduce inflammation and manage stress, both of which impair thyroid function. If needed, thyroid medication can be life-changing, but make sure you're getting the right kind and right dose. The fourth cause is specific nutritional deficiencies that directly affect brain function. Your brain requires specific nutrients to produce neurotransmitters, maintain myelin sheaths, generate energy, and function properly. Deficiencies in these nutrients cause brain fog. The biggest culprits are B vitamins, especially B12, B6, and folate. These are critical for neurotransmitter production and methylation, biochemical processes essential for brain function. B12 deficiency in particular causes severe brain fog, along with fatigue and neurological symptoms. Vegetarians and vegans are at high risk for B12 deficiency since it's only found in animal products. But even meat eaters can be deficient if they have absorption issues. Iron deficiency causes brain fog because your brain needs iron to produce neurotransmitters and for oxygen transport. Women with heavy periods are particularly at risk. Vitamin D deficiency affects mood and cognition. Magnesium deficiency impairs energy production and neurotransmitter function. Omega-3 deficiency affects brain cell membranes and inflammation. What helps? Get tested. Ask for vitamin B12, ferritin, vitamin D, and magnesium RBC. Consider testing homocysteine, which indicates B vitamin status. If deficient, supplement strategically. For B12, use methylcobalamin, not cyanocobalamin. For iron, use a gentle form like iron bisglycinate and take it with vitamin C. For vitamin D, take D3 with K2. For magnesium, use glycinate or threonate. For omega-3s, get at least 1,000 to 2,000 millikilometers combined EPA and DHA daily. Address absorption issues if present. Low stomach acid, gut inflammation, and certain medications impair nutrient absorption. Many people experience dramatic cognitive improvement once deficiencies are corrected, though it can take weeks to months to replenish stores. The fifth cause is poor sleep quality, and this is probably the most underestimated factor. Sleep is when your brain clears metabolic waste through the glymphatic system. It's like your brain takes out the trash at night. When sleep is insufficient or poor quality, waste products accumulate, literally clogging up your brain's ability to function. Even if you're sleeping 7 or 8 hours, if the quality is poor, lots of waking, not enough deep sleep or REM sleep, you won't get the restorative benefits. You'll wake up foggy and stay foggy all day. Sleep deprivation also impairs glucose metabolism in the brain, reduces neurotransmitter production, increases inflammation, and impairs the prefrontal cortex. your executive function center. What actually helps? Prioritize sleep hygiene ruthlessly, consistent sleep and wake times, even on weekends. Dark, cool bedroom, 65 to 68 degrees Fahrenheit. No screens for an hour before bed, or at minimum use blue light blockers. No caffeine afternoon. No alcohol, it fragments sleep, even if it helps you fall asleep initially. Address underlying sleep disorders. If you snore heavily or wake up gasping, get evaluated for sleep apnea. If your legs are restless at night, check ferritin levels. Low iron causes restless leg syndrome. Consider magnesium glycinate before bed. It promotes relaxation and sleep quality. Consider sleep tracking to understand your sleep patterns. If sleep problems persist despite good habits, see a sleep specialist. Improving sleep quality often produces the fastest improvement in brain fog of any intervention. The sixth cause is gut dysfunction affecting your brain through the gut-brain axis. Your gut and brain are in constant communication. When your gut is inflamed, has dysbiosis, bacterial imbalance, or has increased permeability, leaky gut, it sends inflammatory signals to your brain. This causes neuroinflammation and brain fog. Your gut bacteria also produce neurotransmitters. About 90% of serotonin is produced in your gut. When your microbiome is disrupted, neurotransmitter production is affected, impacting mood and cognition. Gut problems that commonly cause brain fog include SIBO, small intestinal bacterial overgrowth, candida overgrowth, parasites, dysbiosis, and leaky gut. Food sensitivities causing gut inflammation also trigger brain fog in sensitive individuals. What helps? Address gut health comprehensively. Consider testing for SIBO, stool analysis for parasites and bacterial balance, and food sensitivity testing. Remove gut irritants, processed foods, excess sugar, inflammatory oils, potential food sensitivities. Add gut healing foods, bone broth, fermented foods, prebiotic fiber. Consider a probiotic with multiple strains. Supplements like L-glutamine, zinc carnosine, and collagen can help heal the gut lining. Reduce stress, which directly damages gut barrier function. Many people find their brain fog lifts dramatically once gut health improves, though this can take several months of consistent work. Here's the bottom line. Persistent brain fog isn't normal. It's not just stress, and it's not just aging. It's a symptom telling you something is off. The most common root causes are chronic inflammation, blood sugar dysregulation, thyroid dysfunction, nutritional deficiencies, poor sleep quality, and gut problems. Often it's a combination of several factors. The solution isn't just drinking more coffee or taking a nootropic supplement, though those might help temporarily. The solution is identifying and addressing root causes through proper testing and targeted interventions. Get comprehensive blood work. Test inflammatory markers, thyroid panel, blood sugar regulation, key nutrients. Address what's out of range. Clean up your diet, prioritize sleep, manage stress, fix your gut, and move your body. Brain fog is fixable when you address the cause instead of just treating symptoms. Your brain wants to work properly, you just need to give it what it needs and remove what's interfering. If this was helpful, hit like and subscribe for more science-based health content. Comment below, which of these causes resonates most with your experience? Thanks for watching, and here's to clear thinking.